Will there be a fourth stimulus check? I don't know. But before you click away, I want to tell you about something that's included in the American Rescue Plan Act that could be even more valuable, especially if you're self-employed. The American Rescue Plan Act is a huge $1.9 trillion package that includes everything from extending unemployment benefits to assisting with vaccine deployment and, of course, the famous $1,400 direct payments. And while the stimmy checks are certainly one of the more popular and tangible pieces of the bill, there's a much less talked about benefit that could actually put more money in your pocket. Starting in April, health insurance premiums on the marketplace are going to get a lot more affordable. Since its inception, the Affordable Care Act, or Obamacare, has been a blessing to some middle-class families and a curse to others. Based on your income, you're eligible for subsidies that essentially cap the premium costs at a certain percentage of your income. Now, I'll run some numbers in different scenarios in a second, but the nutshell version is this. The American Rescue Plan could potentially cut your health insurance premiums in half, and then some. When I was shopping the insurance marketplace earlier this year, it would cost roughly $600 a month to put my wife and I on a middle-tier health insurance plan, and our 3 kids would be insured through CHIP. On April 1st, that's tomorrow, as of when I'm recording this, those same plans would cost us about $295 a month. That's 50% less, or $3,600 in savings, or the equivalent of 2.5 stimulus checks. So let me back up. Will there be a fourth stimulus check? Yes. Kinda. When will it come? April Fools! But seriously, on April Fool's Day. That's when this is going into effect. All right, let's take a closer look at what's going on here exactly. Here's a table from the Kaiser Family Foundation's website that shows, based on your income, what you could expect to pay as a percentage of your income for a silver plan on the marketplace. Now, you need to calculate your income as it relates to the federal poverty level, and that varies by household size, so you need to bring in another table, like this one that I found from the Department of Health and Human Services, and we crunch some numbers. Scenario number 1. Let's say you are married and you have 1 child, and together you make, let's say, $68,700 a year. This is the median household scenario for the U.S. 68 to 69 grand and a family of 3. Math. You are making about 312% of the federal poverty level, which puts you in the subsidy bracket that's going to cap your insurance premium at 9.83% of your income, or about $562 a month. Under the American Rescue Plan, my how the turns table. The percentages drop significantly. Now Mr. and Mrs. Median are on the hook for a little over 6% instead of over 9%, and they're paying $350, $360 a month. What's that? $2,400 of savings? So almost 2 stimulus checks. Another big change is the 8% 5 premium cap for any income amount. Previously, if you made more than 400% of the federal poverty level, any subsidies, poof, vanish. This creates what some people call a Subsidy Cliff. You're driving along, making some money, living the American dream, trying to make some more money. As your income increases, your subsidies decrease, which makes sense. But then all of a sudden, crash. This is Samantha Median, decides to go back to school, get her master's, ask for a promotion, and now the family is bringing in $85,300, moving them up from a little over 300% of the federal poverty level all the way to 400% of the federal poverty level. That's right on the cliff's edge, but they're still, at this point, eligible for financial assistance. Then Christmas comes, and Samantha's company gives everybody a modest $200 bonus and a TGI Fridays gift card. Now, they're over 400%, and crash. When the median family was making $85,300 and still eligible for subsidies, they had to pay about $695 a month for health insurance costs, or $8,340 a year, which netted them about $77,000 after health insurance costs. That $200 pushed them over the edge, and now that they're uneligible for subsidies, they have to pay $13,740 each year, a 65% increase, netting them $71,600 after they pay for insurance. That $200 bonus cost them $5,000. Maybe this is why some people don't like how Obamacare works. Now, maybe there's some tax magic they can do to bring their adjusted gross income below the threshold. Maybe you're asking, why isn't Samantha's company paying for her health insurance? I don't know. Maybe there's fewer than 50 full-time employees at the business. We can dance this dance. I know it's not a perfect illustration. I'm just trying to demonstrate how the subsidy cliff has worked in the past, and how the Affordable Care Act has drawn a very thin line around affordable. For a full-time freelancer such as myself, who doesn't know exactly how much he's going to be bringing home this year, maybe I'd make some decent money, but still qualify for health insurance savings. Or maybe I'd get a pretty big project and make some really decent money, but have to take an extra cold bath at tax time. I just decided to go a completely different route and avoid this, and went with a health plan off exchange. I can cover my whole health insurance shopping experience another time. The point of this video is to explain how everything is different now. The cliff is gone and the premium caps are much lower. Mr. and Mrs. Median can happily take the Christmas bonus and the gift card and not have to worry about paying $14,000 in health insurance premiums. Under the American Rescue Plan, their health insurance costs are going to be $7,000. That's 5 stimulus checks worth of savings, and enough to buy 554 TGI Fridays whiskey glazed donut burgers, and one of their new amazing blazing pound of cheese fries buckets. Disclaimer, all of this is rough. I'm not an expert on taxes or health insurance or really anything else, so there may be some inaccuracies in how I presented this. I've been using the savings calculator provided by the Kaiser Family Foundation. I'll link to that below so you can plug in your own numbers and figure out your estimated savings for your specific situation. And soon enough, the marketplace should have their updated prices, so you can just go straight there and see what sort of savings you can expect and if there's a plan that suits you. I don't know for sure what's going to happen or how long this will stay in effect, even if it's only for a year. It's a good opportunity for your family to save some money and maybe get some better health coverage. I think all of this is extremely beneficial for my fellow self-employed sojourners. I remember when I was considering making the shift from employee to self-employed, the prospect of losing my health insurance and other benefits was a huge hurdle. It's a huge burden to bear if you're used to your employer covering most of your health insurance premium costs. And it's especially weighty if you have a family that's relying on you. So I'm really grateful for this provision, and I want to make sure as many people know about this as possible. It seems like there's not a lot of conversation around this piece of the bill. I guess it's not as sexy as the direct stimulus checks. I don't know, I think it's pretty hot. Also worth noting, the open enrollment period has been extended to August 15th. Originally it was January, then they pushed it back a month, and then another month, and now people are going to be able to turn on and turn off their health insurance like it's an HBO Max subscription. I don't know. But it gives you plenty of time for you to do your research and find a plan that works for you. One final thought before we part. I've been learning a lot as I've been growing my business, and there are some things you can do to throw gas on this fire and unlock even more savings. For instance, if you structure yourself as an S Corp, there are a number of moves you can make to reduce your taxable income, which in turn reduces your health insurance costs. Remember, premiums are calculated as a percentage of your income. There's a lot more fun you can have with an S Corp, but that's a whole other video. If you want to see that video when it comes out, be sure to subscribe to this channel, hit the like button, blow this video a kiss, and do all the other sorts of YouTube magic. I love talking about this stuff, and I love sharing it with you, and I just want to see you succeed, be able to be in the best position possible to take care of yourself and your family. I hope this was helpful. Have fun shopping for insurance, have a happy Easter, and I'll see you in the next one.